Hi, my name is Derek Mahoney. I'm a specialist orthodontist from Sydney, Australia, and today I'd like to talk to you about a new revolution in clear brackets. This is the Shark bracket. It's one of the first brackets that has been produced via resin printing. It's not made of a pure ceramic, but rather a ceramic reinforced composite, and as a result it's very, very easy to bond. If we have a look at this bracket, you can see the base is an underlock, and it's very, very easy to reposition if you have put your bracket on maybe at the incorrect axial positioning, etc. And I'll talk about that in a moment. But at this stage I want to show you the mechanism. Basically the gate is opened with a special tool, and the wire is placed, and then the gate can be closed with your finger, or again can be closed with the same tool. One thing that we've noticed since we've been using this bracket in our practice is that because it is so clear, food can sometimes show through the bracket. And that's why it's very important for patients to understand how to clean effectively around the bracket. The other thing is the type of adhesive you use. I use either blue glue from Ormco, or I use Transbond XT from 3M Unitech. Both of those glues are quite color stable, and as a result, when they're placed and you see through the bracket, it doesn't make the bracket look darker. Now, one thing that's important, because of the mechanical underlocking here, you need to work the glue into the bracket. That means your assistant can't just place the glue there, they need to place the glue and work it into the grooves. If you need to remove the bracket to reposition, my suggestion is to use a Vinegard plier on either side of the wings and just simply do a turning action so that you can pop the bracket off, then sandblast the adhesive off and reuse the bracket with very good bond strength. And that, I think, saves a lot of costs when it comes to repositioning of clear brackets. The bracket comes in either an 018 slot or an 022 slot. With my clinical background, I've been using 022 from the day one, and as a result, the strongest wire I can place into this bracket is going to be a 2125 wire. Remember, the size or the slot of this is a 22 by 25. We prefer not to use stainless steel in this bracket. We find the forces are very heavy. So what I like to do is to start with a copper NiTi, normally a 0.014. And then I work up to a rectangular copper NiTi, and I finish in a rectangular beta titanium or TMA wire. Using that wire progression, we don't put extra strain on the gate mechanism, and we've had no problems as a result of that. What I say to my patients about cleaning with this bracket is to use a sonic air floss. The sonic air floss allows the patient to clean effectively around the bracket. When they come in for their normal rewire, I will open the gate, take the wire out, let the patient go and floss and brush with the gate opened. Because it is such a clear bracket, if food gets caught underneath the gate mechanism, you will be able to see that. The first bracket was so clear that any food was visible. What they've done with the new bracket, they've put a frosting on this surface, and as a result it's not as visible. However, using the sonic air floss, the patient should be shown how to clean effectively between the wire and the bracket slot, and also around the bracket. And if a patient does that correctly, we don't have any problems with aesthetics or food getting caught there. The original bracket that we beta trialed had a T gate. So as a result, when you open and close the gate, there was still an opening that food was able to get into. With this new gate, you can see that opening has been eliminated. So that also minimizes food entrapment. Having said that, with all these brackets, particularly because they are so clear, the patient has to take the responsibility to do effective cleaning. And I think it's important for your staff to sit down with the patient once the brackets have been placed and really explain how they effectively clean around the bracket to maintain those aesthetics throughout treatment. When you open and close the gate to this new bracket, it's important to use the tool that's provided with the system. I've noticed some doctors try to use a Dental Explorer. That is too fine a tip and it's very flexible. So as a result, it puts stress on the gate mechanism. The actual tool is more rigid and it has the right ending so that you can easily open and close the slot without any difficulty. Also remember, before you work up your wires, you need to ensure that spacing has been created. I see a lot of doctors who will place this bracket start with the correct wire, which is a 0.014 copper NiTi wire, but then just because they're used to doing this, they will wait one visit and then up to a rectangular wire. I find that if you leave the 0.014 copper NiTi wire in for an extended number of visits until space is created, then it makes it an easier transition and less stress on the bracket. If I show this typodont, this is illustrating what some doctors will do. You can see that this case has been stepped up to a stronger rectangular NiTi wire much quicker than it should have been. I normally like to see spacing between my teeth after a number of visits of 0.014 copper NiTi. Then I transit to the rectangular copper NiTi. If you look at this typodont, you can see this wire has a lot of force just to be placed in and outside of the bracket. So as a result, it's going to put more force on the gate mechanism. The prescription for this bracket comes really in a high torque, which is a biprogressive prescription, a standard torque, which is MBT, and a low torque, which is Roth. The brackets come with hooks on the 3, 4, and 5. And what I find in opening and closing, obviously loops are required, but you can see here with the opening and closing tool, it's quite easy to open the gate. You can place the wire in. To close, I just normally use my fingers supporting the tooth as I do so that the patient comfort level is ideal. But it's a very, very aesthetic bracket, and I get a lot of great comments from my patients when they have the bracket placed and their friends are amazed that they actually are in treatment with braces.